My name is Dr. Heather Prime. I am a clinical psychologist and assistant professor at York University in the Department of Psychology. And the award is really allowing us to do some important work to support families recover from the pandemic. I'm partnered with Sick Kids Center for Community Mental Health, and they have a really interesting program wherein they work with uh, full families, entire families. So rather than working with just the child or just the parents, they bring everyone together and work with them to help strengthen those relationships. And they're really interested in providing these brief interventions that aim to strengthen the co-parenting unit, so the relationship between two parents or caregivers. And if they're interested in, when we do that, will that then have these cascading effects on the rest of the family that can help families to really move forward in with healthy patterns of interaction. And we know that those sorts of healthy patterns have important implications for children's mental health. So they've designed this program, and what the Banting Award is allowing us to do is evaluate it and to really see, how is it working for families? What are the adaptations that we might need to make it useful to diverse families and the current context? What are families saying about it? And what are the research processes? One of our main questions is, how can we study this within a community mental health setting? So setting up the processes to allow us to evaluate it, like getting measurement and questionnaires within the program, and just processes to be able to interview clinicians and interview clients so that we can learn more about what the mental health center needs to make this program successful. And I think what's happened in the pandemic is that families have been really stretched. So those families who were already strained and maybe lacking resources, both emotional or financial or otherwise, or who were already having difficulties wherein their children were showing some mental health difficulties, or the parents themselves had mental health difficulties. I think that the pandemic has heightened that. So not only has the pandemic reached a wide group of people, everyone has been touched by the pandemic in some way. And so the mental health needs of the entire population have likely increased on average. But where I'm really interested and concerned about those more vulnerable families who were already stretched before they faced the social disruptions of the pandemic. So things like, widespread job loss and economic instability, lack of access to resources at schools, and potentially food insecurity, as well as, the innumerable stressors that families have faced. There is so much really sophisticated and well-designed research happening right now in terms of, researchers have come up with really sophisticated methodologies to study very complex questions. In my field, we're trying to tease apart um, cause and effect in human development. That's really hard to do, and in order to do that, we need to follow families over time, and we need to use multiple methods, whether it's questionnaires or observations. And it, all research fields have their own demands, and we have really capable researchers, and the funding is necessary to put those ideas and methodologies to use. We can't do our work without funding from donors like those who contribute to the Banting Awards. So I am so grateful, as are, I'm sure, all Banting awardees and all applicants who I'm sure were very strong candidates for this award.